I'm Laura Blumenthal on the Berkshire Heroes podcast, and joining me today is Shahid Younis, the director of SureCare, a home care company, and he is also a councillor on Woking Borough Council. Welcome, Shahid.
Thank you very much, Laura, for kindly inviting me to your podcast.
Well, thank you for joining me. We all know that care companies are facing all sorts of different pressures. Can you tell us a bit about what your care company does, who it seeks to help, and what drove you to set it up?
The company was set up 2 years ago with a prime mission to provide high quality, compassionate care to the elderly people so they can live with respect, dignity, and comfort in their own homes. Actually, this is the type of services we provide are live-in services, respite services, all type of personal care in their own homes. What really drove me, Laura, is actually our passion for service. And that's what really drives me. So adding value to other people's life, because I've seen myself at first hand how right care can transform the quality of care for individual. And that is what I thought I should play my part in this.
And we've seen a lot of changes when it comes to recruitment for care workers. We've seen Keir Starmer has announced plans to stop the recruitment of care workers from abroad. Can you tell us a bit about the challenges that care companies are facing now and most likely on the horizon?
The biggest challenge, one of the biggest challenge is actually recruitment and retention. There are approximately 1.6 million people work in the care sector. Recent changes, one of them has been that to stop people from coming outside. That will create a lot of issues in the time to come. We have actually acute problems now in the care sector, getting the right people, motivated people who would provide these essential services to some of the most vulnerable people, community members of our community. That is going to create even a bigger challenge in the years to come. We have issues now, but you can just imagine if there's no additional staff coming in, then that is going to make even the bigger problem for us. So recruitment retention, I would say, is the number one issue for us. Also, I find it to do with this as well. A lot of people don't want to do the care work because maybe it's not well rewarded. It's not highly compensated. There doesn't seem to be a structure in terms of career planning, career professions, or development. So I think there's a lot of work needs to be done in this space to make it more attractive and also higher compensation as well.
And what do you think some of the solutions can be? What do you think the UK can do to really recruit people more internally?
That's quite a challenging, difficult question you asked, Laura. I think there's a number of things we need to do. One is that we need to reframe a mindset in the UK, how we see the care work. It is not undervalued. As I said before, it is undercompensated. Yet I would say it is actually should be on the same par as nursing or teaching, because they provide essential services to some of the most vulnerable people in our communities, right? But there is no career progression for them. There's no, like you do in NHS, for example, right? So there's a career path, there is a proper structure in place. So what we need is something equivalent, perhaps, a national care service where there's a proper structure, training, career paths, and well compensated. So that's the one thing. But that means we need to have a debate at the national level, cross-party basis, and reframe a mindset of how we see and view the care sector. We can learn from some other countries as well. There are some good models in Nordic countries. So our approach at the moment, the way I observe, is very reactive into care business. We need to change that into proactive. For example, and there's a model well known in Netherlands where they have nurses and qualified staff working in the field, going to people's care home. Potentially there could be an issue, so they can see the problem coming well ahead before actually it becomes a problem. That means is a better care outcome for the elderly in the community, but also is less costly as well for the health service. And third aspect is perhaps we should look at places like Japan, where they're introducing a lot of technology, robotics and AI, where perhaps we can, in terms of monitoring and medications, etc. So we can use some of those latest technologies to help elderly care to live with dignity and also self-respect as well. One other thing we got also from Norway, I think, and also Germany as well, what they do is that their training programs are very much integrated with health service and the care sector. At the moment, we have two. One is health side, one is a care, but this integration is not seamless. That comes a huge problem in the UK. And this is where some areas we can actually learn from Germany and Norway, where actually the training, for example, program includes the care sector as well as the health service, where people are better informed and the transition is very smooth. Let me give you an example. At the moment, as we know, patients have an operation in the hospitals, but they can't be released until there's a care arranged for them at home. So the bed is locked, right? And each day the bed cost, I actually did a Freedom of Information a request to our local hospital, and they say approximately costs about nearly £400 a night for a bed. And if you just extrapolate that with the thousands of our patients who are in a similar position, they want to go home. They don't want to spend time in hospital. Hospital is probably not a great place, right, to go for recovery. But if you extrapolate that, that goes into, there's a one estimate about almost £1 billion a year, which is costing the NHS because the beds are locked. They can't actually do, somebody else can come who probably need it the most. So that actually integration between, that needs to be seamless. And also,
and how can we get better at that?
I think that means the social sector. I mean, there needs to be more integration between the health service, our local council, because they provide a lot of the social care as well. So there needs to be for example, there needs to be more proactive engagement with the social care for the council. So making sure that if, for example, the patient is going to be released next Wednesday or next Monday, then already the discussion has been placed, the care has been arranged, and when the Monday comes, straight away, the patient can move and empty the bed and go to their homes. But sometimes what happens is because of number of reasons, bureaucracy, and things are delayed, and the patient could end up staying there for a week. And if you just extrapolate 7 times 400, right, that's a one patient, and it just is costing, obviously they are paying for it, and we can save so much as a result of that. So there's a huge opportunity for efficiencies there.
So a lot of people be listening thinking care workers need to be paid more. I think everyone is in agreement of that. And I'm just wondering, with the Prime Minister's proposed changes of not being able to recruit people from abroad when it comes to care, how is that going to change with salaries? It must mean that they'll go up. And of course, that means that people are going to have to pay more as well. And I was just wondering how that dynamics are really going to work and how it is in your world.
Laura, you're absolutely right. The care workers are underpaid at the moment. They do a huge valuable work and they need to be paid more. I totally agreed with that. But Prime Minister has started this initiative. Yes, they should be paid more, but I think this question always comes up, simple economics, that the companies who are providing this service, they will end up increasing their charges to the end clients. Otherwise, they won't be able to do that. And that will mean that cost will become even more for the clients, which are already struggling at the moment. Even I've seen in typical middle-class families, they are finding the cost really huge. And this is as a result, I see that, all their inheritance probably will be taken off. A young generation will be worse off, more poorer, I find. And this is probably the first time happening for a long time, because if elderly needs a care for the long duration, then most of the assets will be depleted and there'll be nothing left for inheritance to left. So yes, it should increase, but the question is how it's going to increase, right? So there's two types of social care. Where does the funding come from? Well, number of ways, right? But I'll just mention two of them. One is the social care side, where the councils provide the funding, which is obviously provided through the local taxes or maybe some central help they get. So, but and the other one is that the people who are affluent and they are providing it and are paying it themselves. So yes, you can charge them more. slightly to the private clients to some extent, but not huge. But other thing is that there needs to be a huge injection from the council side as well, because at the moment they are paying a very low amount to the providers, which means they can't pay higher rates to the care workers, which means they can't invest in their training and their development, and there's heavy compliance to go with that as well. That's another thing to bear in mind. CQC, all the care providers are registered with CQC, and we have to navigate around the compliance aspect of it. So there's a huge cost that comes as a result of that as a provider. So it is a complex issue. It's not a simple, straightforward Prime Minister saying it and the problem is going to be resolved. End of the day, these businesses are, these companies are businesses as well. They have to balance their books. So money has to come from somewhere. As the social care funding increases, that's one thing they should do. But that is a political, angle as well, and they need to do that.
And SureCare is a home care company. Obviously, care homes are totally different. Well, what are the margins like in your industry?
See, the clients we have from the social care, from the council aspect, the margins are very small, very thin margins. Only small margin you have is increased, relatively more is from the private clients. So, but most of that is the point I'm saying. You can't really increase the care workers' salaries if there is no injection from the central government into the social care side. So the problem is the funding. Just for just to bring this up, right? There was a parliamentary report done, if I remember correctly, in 2023, and they said they need the care sector needs an injection of 15 to 16 billion pounds straight away, and also I think 6 to 7 on a regular basis. So because we've neglected this area for so long, and there needs to be immediate injection of funding into this to bring to some sort of level.
I liked what you said about technology and what they're using in Japan, because when I used to work at BT, we were very much working on trying to encourage customers to install sort of monitors in their elderly parents' houses, not to spy, but just to check on them to make sure that they were okay. So it would alert your phone if the kettle had been turned on in the morning. So you know that mum is up and about. You don't know what she's doing. You can't see her. It's not spying. It's just checking. And if you know, the kettle hasn't been turned on and mum always has a cup of tea, you know something's wrong, and then you can be alerted. Do you see a lot of people, their children, being quite keen to embrace technology, or is it still something they're quite wary of, or they're just not interested in at all?
I think the mindset is definitely changing now. So I think what's happened is that a lot of our youngsters, our parents worked very hard and give them the good education. So the kids have gone for where the opportunity came. So we've got a number of clients who are actually living locally, but their children are living abroad, right? But they are concerned about the well-being of their mother and father, right? So they still want to stay engaged and make sure they're looked after. So we actually look after on their behalf, provide them all the essential services, but also they want to know how things are going on. So they are using cameras from that point of view, just make sure they can actually speak to their parents, using, video calls, etc. You can talk to them. They can't be there, but actually they can regularly have a chat with them, because that is a hugely beneficial for the parents, but also for the children as well. So this is just one example, but there's a lot of other things. If, for example, if you have a fall, then there is a technology available where they can be notified that the person has actually fallen and action can be taken, rather than and not anybody knowing about it. Or when there's a time to take medication, they can actually be reminded on that as well. So there's a number of different ways where the care quality can be improved, but also their independence can be retained as well, and they can live with dignity and respect.
I mean, I remember my grandma, she's in a care home now, but when she was living at home, my mum got her a buzzer to have around her neck, so if she did fall over, she could alert someone. But she just never wore it. She's got dementia, she just never wore it, and that was that. And when she did have a fall, she wasn't wearing it. And likewise, reminders to take medication, it just doesn't seem to happen. This is why at BT we're sort of saying, children, if you care about your parents, you need to be doing the monitoring. You can't just rely on your loved one who might be living with dementia or something else, which means they just are not going to be responsive to that technology at all. But of course, we know that up to 2030 and beyond, we're going to have a much older population, aren't we, Shahid, of over 80s, younger people with disabilities. So this is just a growing industry, really. So it's really quite serious and something we need to get to grips with. Do you kind of see the industry coming together to really push in the right direction? Do you think there are the correct policies going forward? What would you want to see more of?
Based on the last consensus, 19% of the population, UK population, is 65 plus. And it's estimated by 2030, almost 25% of the population will be 65 plus, right? So obviously, with age comes health complications as well. So this is a growth area, right? But I do feel at the same time, and there's a political angle to this as well, as actually over the decades, we have neglected the social care side of things. We haven't handled this, and this should be a non-political issue. And we need to, all the parties need to get their heads together and find a solution which is actually sustainable in the long run. Yes, there's a huge cost associated with that. Maybe that's one of the reason, they don't want to discuss it and they want to find a solution. But it needs to be, the longer we leave it, the more difficult it's gonna get, right? So we have got a lot of challenges in this space. And as I mentioned before, a number of challenges, and they need to be addressed. And the longer we leave it, the problem is not going away. It's actually getting worse. And I feel that we are almost like in a crisis at the moment, and on a busting, point of bust. So it is an urgent issue, and it needs to be addressed on a war footing.
And are there any countries who you think are doing this well, who are really leading in this area, perhaps a model that we can pinch, or perhaps cultural differences? I mean, we spoke about Japan. A lot of the older people there keep healthier for a lot longer. They're much healthier, their elderly population. And I know from other cultures, it's just quite normal for elderly parents just to live in the big family house with their children and their grandchildren, which isn't quite the norm in this country. And I just wondered if you saw anything that you think we can really use as a model here.
Each country is different. Their cultures are different. Their traditions are different. So it's difficult to, get one idea which may work for Japan or Nordic countries necessarily work for UK as well. But at the same time, there are some elements of that we can pick up certainly and see that can benefit us. Thing is that we have nuclear family structure. The extended family structure in the UK almost doesn't exist. Yes, there are some cultures and some communities where it does exist, but that's a hugely beneficial, not only for the elderly, but also for the young people as well, because you're getting that wisdom and, while they're growing up of the elders, but also at the same time, they are being looked after, they're in home. And, one thing really, Laura, is also an epidemic at the moment amongst the elderly, and that is loneliness, because that is linked with that. At the moment, there's this a survey was done, and let's just give you some stats on that. Just gives you an idea how acute an issue this problem is. Loneliness is considered as a worse than diabetes and worse than having 15 cigarettes a day. It's a silent killer, they call it. There are 1 million people in the UK who actually haven't, seen anyone within 5 to 6 days, any person at all. So they live alone and they haven't seen any person at all. There are 4 million people in the UK where the only company they have is actually television. Nobody comes and sees them, and that's the only exposure they have to the outside world. And you know what? One other thing, the biggest problem is amongst the young people from 16 to 24. Even all the social media and all the exposure we have, right? They feel very lonely within. And, sometimes there's a difference between loneliness and solitude, right? Obviously, solitude is sometimes you think it's good for you. You choose to be alone because of your personal development, because you want to just develop some skill, or because your choice, or because of any religious purposes as well, spirituality, etc. But loneliness is because it's not your choice. You're there and nobody's there to come and see you. Your kids are living miles or probably across the continent, and you don't have many friends and who can come and see you on a regular basis. That crosses a lot of other issues. Dementia you mentioned earlier on. That is that is one of the things which can lead to from loneliness to dementia, early dementia, and heart attack and other health related diseases comes with this issue as well. You probably know, Laura, we have actually under the last government, a minister for loneliness was a post was set up specifically because at the centre, Westminster, they realise how big of this problem is. But I think we need to address this aggressively, and that's an important issue.
I was interviewing Margie Walker, the CEO of the Link Visiting Scheme, and she said that the demand for people to visit the elderly who are lonely is just through the roof, and they're crying out for volunteers. So it does very much echo what you say. So tell me a bit more about what is it like you on the ground when you're trying to recruit people? You put out a job advert. Do you get any responses? Do you get some responses? What does that look like?
We use various social media and also to recruit. Indeed, for example, Facebook, all the other Instagram, etc. So we all use, and also agencies as well. What we find is a lot of the inquiries we come up, responses are from people who are abroad, right? So less inquiries come up from who are local. They do, but they're less in terms of percentage wise. Other thing is that some of them they are actually only looking for something short term, but not long term. But obviously in this care business, we want to have this continuity. So we have this, to give you an example, last advert I put out, I had 300 responses, but we only had selected 4 of them. Because it's not about the people you respond, it's the type of people you want to recruit as well, with the right personality, who's actually caring, compassionate, right sort of attitude. So we've got a very strict policy within the UK as well, that we're not going to recruit everyone, but we will recruit people with the right attitude, personality, and the compassion for care, because that impacts the quality of the care we provide as well, and that is what we pride on. We want to improve the quality of the care, but you can't have well-trained, motivated, less trained and less motivated staff and high quality of care. It doesn't go together.
And the small select number that you did look at in the end, were they mostly from abroad or were they Brits as well?
It was a mixture. We had 2 people from local and 2 people who already were in the UK and came through sponsorship. But then we ended up sponsoring them at the end, right? So because the attitude they had, they're highly committed, highly educated. One other thing we look for, make sure the communication, they have good communication skills as well. So they fit the criteria. We ended up sponsoring them, but we are very satisfied with the performance. We've had them for last 9 months now, nearly a year.
Glad to hear it. And now that the Prime Minister has said that can't recruit care workers from abroad, what do you think is going to happen? Do you think care companies are going to be paying people more to try to attract the talent from the UK? Because I know we've got 5 million people on out of work benefits in the UK alone.
I think it's a mixture of things I would say there, right? One is in the long term, I feel that it would create a major problem. Problem will get worse. What we need to do is, there was one suggestion of perhaps setting up a national care service. I think that is the right direction to move into, but that needs to be like we got NHS, with proper training, career paths, compensation, which is pay and conditions are proper as well. That needs to be on the same level, right? So at the moment, there is a lot of abuse happening as well, and I can understand why this has happened, to stop the people coming from outside. There are some companies who are actually abusing the system as well, and they should be stopped, rightly so. But that doesn't mean that in the long term, you actually create a bigger problem for yourself. So there needs to be a balanced approach. We need to get rid of those companies who are exploiting people from overseas, but at the same time making sure that the good companies, they have the right staff and a pool of people to select from.
And do you have a particular memory with working with your company of helping an individual or their family to make sure that they're getting the care that they need? Is there something that really stays with you of thinking, I made a real difference here and this is going to stay with me for a long time?
Laura, there's a number of incidents. Honestly, in this business, we find is every day is something else, as a new comes up, new issues we have to deal with. There's one particular one where one elderly lady, she had a hip replacement, and family contacted us. She needed full-time care at home, and it needed to be done in an emergency. And so they contacted us. They were not sure what to do, how to approach things, etc. We responded, and we basically took the whole case ourselves with their support, and they were happy for us to do that. And within 24 hours, we did the full assessment, prepared the care plan, provided one of our experienced carers to them, and within days, a couple of weeks, you can see the transformation. The lady got more mobility, she got more confidence as a result of that, and the family were so thankful for being there for them when they needed it. So that is the reason, one of the reasons, Laura, the first question was, why did you set this up? Is that adding value to other people's lives. So as a result, people are, your service you provide, you are improving the quality of life of the people. It's not about the task which we do, it's actually taking all that, giving them a respite, for example, and taking that pressure off the family as well. So they can spend time with a loved one as a family, but not as carers.
And what is SureCare focusing on right now, and how can people find you online?
At the moment, we are we are expanding our services across more geographical area, focusing more on the quality of the service we provide. We are spending and investing a lot of our resources on staff development, because the quality of care, the quality of staff and motivated staff is so crucial to provide the quality of the care to the individual as well. So that's where the time spent and resources are being spent. And also we are exploring some new technologies as well, where we can help the elderly to perhaps live with dignity and independence in their own life. So there's a number of things we are doing. Again, the focus is the client, the quality of the care which we provide to them.
And final question, Shahid, if you were Prime Minister, which law would you introduce or change, and why?
Well, let's put it the other way, Laura. If I was in personal responsibility, there's a number of things I would really like to introduce if I was in the care sector. Number one is actually to reframe the whole debate about how the care sector is viewed generally across the country. Because I think it's undervalued, is undercompensated at the moment. And as I said before, it should be raised up, the bar should be raised up, and this should be the same level as teaching and nursing. That's number one, I think we should do. Secondly, we need to set up, as I said, national care service, so making sure that this is on a par with NHS, where there's a proper career path, proper training, proper trainings for all the staff, and they feel appreciated, which can attract the younger people as well. Because young people nowadays, they don't just want to work; they want a purpose, in what they're doing as well. At the moment, it's not about doing the task; it's they're providing a service, and that's a purpose, right, behind it. And young nowadays people, they're not always looking for money either, right? So that's the important aspect of it. So I would definitely say national care service, set that up. But also in doing that needs to be a greater integration between the National Health Service and the National Care Service as well. Seamless integration. That needs to happen. And thirdly is that, maybe more time and more resources into introducing some new technologies, into the healthcare. Because as you highlighted before, Laura, we are getting older and older, which is a blessing in a way, but also it actually comes with the challenges as well. So we need to find a solution across all political spectrums to sit down and say, look, find a solution which is sustainable and which works for everyone. And that's the important side. And lastly, I would say we need to become a more caring society as such. right? At the moment, what we find, my personal perception is that we are a society where with social media, we know everything around the world, what's happening, right? Touch of a button, 24/7, but we don't know what's happening on our next door neighbor. There are cases, sadly, where a person is in great difficulty, but we are having a great parties, right? And we don't know what's happening. So that connection needs to be there. I think we individually, we need to be more responsible, more caring, making sure how our neighbors are doing. Just keep it. It's not, spying on them, but especially those who are vulnerable, to make sure that we are there for them and provide the support. The state can't do everything, they can't be there at all places, but we as individuals, we need to take on this responsibility as well. So develop a more caring, more inclusive, and more fairer society. And every policy we implement, that should be the end objective of that.
And when it comes to technology, do you have any examples in mind? Because you're working in this sector at the front end, so just really interested to know, what is the technology that really could help people?
Obviously, there's a number of technologies being tried at the moment. I mean, it's difficult to say one thing which will solve every, as all issues. That's not gonna come. Robotics, automation. I mean, there's in Japan, there's robots who can come and do your, some mundane tasks. For example, they clean and they hoover everything for you, right? So you don't need to do that. Or some other, household chores can be done. But obviously, if you're elderly, you have to do everything yourself. There's nobody else, right? So rather than getting somebody from outside, you can actually employ that. But also, I think the biggest thing is that, and anybody, for example, falls, anything happens, because they're lonely, they need to be notified. Somebody needs to be notified so action can be taken. And a lot of the elderly people I find, they haven't adopted those technologies. Some of them are resistant deliberately. You mentioned the dementia aspect, right? We got a number of clients who actually are in that situation. So for them, we provide 24 care for them. So we have basically somebody living with them, and they will take them wherever they need to take them. So that is what they want, because that is the highest quality you can provide. Because sometimes, as you said, even if you have something on with them, they won't actually wear it, right? Even if you got some sort of tag which will tell you if you've fallen, but if they don't wear it, that tag is no useful. So I think it's a big way. Yes, technology will only help if you adopt it. If you don't, right, then it doesn't matter how wonderful the technology is, it's not going to work.
No, of course. Well, thank you so much, Shahid, for joining me today on Berkshire Heroes. It's been incredible to talk to you. Thank you so much.
Thank you very much, Laura. It's a pleasure to be here and talk to you about this very important issue.